So Sarah, we've been very fortunate to enter into collaboration with GE to bring to Northern Ireland the first cardiograph scanner. This is a very special CT scanner that allows us to image the heart in less than a heartbeat. So we get all of the information that we need to make a diagnosis about coronary artery disease very, very quickly. With a scanner like this, it's like a crystal ball. If we find you early enough, we can image early narrowings in your heart artery, and with the current evidence base, we can start you on preventative treatment that some papers are suggesting could reduce future heart attacks by between 30 to 50%. By chance, actually, I was a patient who attended our rapid access chest pain clinic, did a very good treadmill test, but had risk factors for heart disease. And on that basis, Dr. Rohr, one of our associate specialists in the Ulster, had referred him for a CT scan. So you can imagine our surprise when we see some little atheroma or plaque in the arteries or narrowing in the arteries, but the major concern was a little mass within his heart, and he was admitted for further evaluation of that. But I think that wouldn't have been identified as early as we have managed to identify it if we had not had access to the CT scanner.
Last Thursday I came for a CT scan on this new machine and went home, and on Friday evening I was heading up to Kingspan towards Ulster when my telephone went, and it was my wife Susan, and she said, John, the cardiac board have been on from the Ulster, they want you to phone them. And I said, oh, Susan, I'm going to the rugby match. She says, give them a ring, which I did. And I phoned the ward and I said exactly the same. I said, oh, for heaven's sakes, I'm going to the rugby match. And the staff said, well, could you come after the match? Meanwhile, my daughter was going mad. She was driving. She was going mad. She says, Dad, catch yourself on. Don't be so stupid. If a cardiac ward's phoning you and looking you in, you've got to go in. So instead of turning right to the rugby, I turned left to the Ulster. It's since been confirmed by Dr. Donnelly that in fact there is a mass, and I've a few further tests to do, but from what I can gather, it is going to require surgery. It's as I've said before, you know, they say the age of miracles is past, but how can you say that when there's that wonderful machine that is picked up on something that a short while ago it mightn't have picked up? The National Health Service, you hear them criticised so often that the staff have been absolutely wonderful. And I'm not saying that to get an extra cup of tea.